Martha, you said you didn't have any experience with IV immunoglobulin, but would you recommend it as a last resort in some patients?
I would recommend it as a last resort, but I can only tell you, and sometimes it's not a prospective randomized study, not evidence-based medicine, but a year ago, I saw a patient in London coming to do egg donation. She did 20 embryo transfers in the United States. Then she went even to India, in the UK, and she did 20 embryo transfers. She is a very rich person because she went 20 times to do egg donation. And she came to me, and she showed, I asked her, what do you take? And she took her bag, and she put all the bag on my table, and it was like medications like this. Maybe I was lucky from God. I told her, throw away all the medication. And she said, you're not going to give me IVIG? I said, no. You're not going to give me steroids? I say, no. I told her, let's clean you out of the drugs, not because I believed it, because I was afraid of the amount of the drugs she's taking. And believe it or not, she had an embryo transfer with the simple protocol of estrogen and progesterone, nothing, and she has twin today. So after doing that, and I have some other stories, it's very difficult for me to recommend for IVIG because it is so expensive and that it is a pooled blood. And I'm afraid to give pooled blood. We are afraid to give. I mean, in the 80s, when we had to give blood, we gave a lot of blood. But now we are very afraid. It's like organ transplantation. So I will consider. But I have not met yet the situations that I will give.
How long will you give the glucocorticoids, steroids?
Normally, in IVF, we start the glucocorticoids. If we go on the long protocol, we start on day 21. And if we go on the short protocol, we start about 1 week before we start the stimulation. And we give very low doses. We give between 5, maximum 20 milligrams according to the case, because we are not doing a study, so we don't have to give the same dose. If we give it just empirically, then we give 5 milligrams sometimes. If we give it because we feel that there is autoantibody or hyperandrogenism or other aspects, then we give up to 20. And we stop. When the patient is pregnant, we stop. Only when we have late onset 70-hydroxylase deficiency, we don't stop. But normally we stop when she is pregnant.
It becomes very frustrating and depressing, not only for the patient and the couple, but also for the treating physician and the embryologist. And then you have a tendency to believe in your own therapies, and as you rightly said, it is intuitional and the evidence-based adjuvant therapies. Every treating physician, I'm sure you all believe that, has their own intuitions. And I, for one, believe in asking my patients to go through a meditation camp or workshop. And do you have any studies or have you ever come across a study where meditation or the ancient Indian yoga and pranayama has had any good effect? Because you have mentioned in the other therapies acupuncture, which is a Chinese remedy. So have you ever come across a study which...
I've never come across of a study of yoga or other means. However, and there are sporadic studies about hypnosis, etc. However, we have done a study. I had a PhD from the university, and she did a fantastic study. She had a disc, a CD, and she gave to all embryo transfer patients a CD, and the patient had the CD just 15 minutes before the embryo transfer in the waiting room. And half of the patient got a progressive muscular relaxation instruction. It's a very, very old system to relax. You contract and you relax. And they were instructed by the earphones how to do progressive muscular relaxation. And then the other group, they were told a story. Okay, so it was the double blind to the doctor. And the patient didn't know exactly. And then we had Afterwards, we asked the patient and the doctor, and what we found was amazing, that the embryo transfer was much easier for the doctor when the patient had the progressive muscular relaxation. And it was fantastic because it is something which doesn't have any adverse effects, and you can put it in the waiting room. And now we distribute to the patients this CD because I believe that if embryo transfer is easy, it contributes a lot. We didn't calculate the pregnancy rate because it was not the purpose. It is stupid to calculate pregnancy rate when we use Indian or muscular relaxation, because you need 5,000, 6,000, 10,000 cases. However, the very fact was significantly easier that the doctor did. And then she also filled in anxiety score and all these things. Everything was better. So why not?
There are no more questions. I think we'll end the session. Thank you so much, Dr. Mar, for such an exhaustive thing. I think I'll have to give you the presentation, so can you come on the stage again?